Good evening, everyone, and welcome to today's wonderful evening NEET PG quiz. Every day we fight, and one of you will become the winner. And the winner gets 500 rupees cash prize. The thrill is not about the cash prize, the thrill is all about winning. That runs in our blood, the victory runs in our blood. It runs in our nerves, that inspires us to play, and to compete, and to read more, read better. After all, what is the purpose of a teacher? The purpose of a teacher is to inspire you to read, reread, reread. So, Doctor, thank you very much for joining. And you all have the link, quiz link, which is available. Just go to your smartphone, enter the quiz link, and then join the game. Now, let us see who is going to be the great winner of today's evening. So we have almost 15 players who are there. Shall we wait for some more players? So you have on the top AHA slides Z05RD, which is there on the top. So please use that link, which is there on the top, to join the quiz. Very good. We have around 18, 19, 20, some more who are joining the quiz. Yes. So some more who are joining the quiz, and let us wait a little more before everyone is into the game. So we have almost 21 players into the game. Today we are expecting more and more, because our 999 rupees for 3 years NEET PG coaching is very successful, very dear, very well appreciated by masses of students. So hundreds of students are joining every day, and our family is becoming bigger. And we are going to have more and more of competition in the days ahead. So, Doctor, get ready with all the required ammunition. And I'm sure we enjoy today's pathology quiz. Now, you're all ready? Yes, that's good. So, very good, very good. So, let us make the start, Doctor. Very good. Question number 1. Let us see, please look into your phone. You are seeing the histological picture. What is false about it? What is false about it? Yes, Doctor. Good. You have almost 20 seconds time. What you are seeing, that histological slide, is it the most common cause of systemic fungus? Are the air coolers are the cause? No. Very good. 5 of you are correct. Actually, the answer is C. Air coolers are not the cause of the spread. That is the actual answer. Somehow, the answer came up to be a little wrong. All right. So now, the question number 2. Question number 2. Yes. So, what is wrong statement about it? Wrong statement about it. Yes. Good. Actually, the wrong statement is option D. Once more, I'm sorry that D is the actual answer. Aspergillus fumigatus lead to bronchiectasis. It caused vessel invasion. It also lead to massive hemoptysis. There was a small error in terms of the key. Okay, question number 3. Yes. Now you are able to see the radiograph on your mobile. So, what type of carcinoma is this? Based upon its location, you should be able to guess. All the central carcinomas are small and squamous. Peripheral carcinomas are all adenocarcinomas. Very good. So, the most common type of lung cancer in women is the adenocarcinoma. It is also called scar carcinoma. And the most common type of the lung cancer in the non-smoking population also is adenocarcinoma. And sometimes it can mimic pneumonia on X-ray. That's a point you need to appreciate. So, Dr. Neeraj is on the top, absolutely. And let us see. Question number 4. Now you look at your phone, what is the wrong statement about this? So first you need to make a diagnosis. So what is the diagnosis based on this radiograph? Then you will be able to answer. So typically it is a spontaneous pneumothorax. Only 2 people have correctly answered. Spontaneous, it is not a tension pneumothorax, spontaneous pneumothorax. The moment the lung collapses, then it will pull it. That's the reason trachea shifted same side. But if it is a tension pneumothorax, then it will push the mediastinum to the opposite side. So it is basically a small fix. Definitely it is not dull, it is tympanitic on percussion. And also there is typically tympanitic on percussion. Yes. So, doctor, we don't have much of correct answers. Now, question number 5. What is the wrong statement about this kidneys? Punctuate answer, doctor. Very good to see almost 31 online students. So, what kidneys these are? Obviously, they are polycystic kidney disease. Very good. Great. Chromosome number 4 is associated with PKD2 gene. Similarly, PKD1 gene is associated with chromosome number 16. It is responsible for bilateral renal cysts, ADPKD. It leads to renal failure. That is also true. There is a hypertension, flank pain, renal stones, secondary polycythemia, urinary tract infection, hepatic cysts, Berry aneurysms, mitral valve collapse. They are all the features associated with ADPKD is what you need to remember. Very good. Snehil, Kirtana, विक्रम फाइस, इन चारों के बीच में अभी लड़ाई चल रहा है. अभी तो रास्ता बहुत लंबा है. There is still a long way to go. Question number 6. Now you are seeing a type of kidney. What type of kidney you are able to see, and what are the true facts about it? What type of kidney? So you should be very sure. This is called horseshoe kidney is what you need to remember. And it has a normal renal function. It is the inferior poles of both kidneys which get fused. And it is associated with Turner syndrome, and it can increase the risk of development of nephrolithiasis. The horseshoe kidney is what you need to remember. Now, doctor, the next question. I'm so happy to see almost 25 players, Anita, Rani, and many more who are all online. Please be sure to join the quiz. Very good. Kirtana is heading on to the top. Question number 7. Now you are seeing the electron microscopic appearance of the glomerulus. So what is something that is characteristically seen here? And you should tell me what is wrong about it. Very good. Oh my God, that was a minimal change disease, doctor. It is minimal change disease. What you are seeing is the effacement of the foot processes. It is responsive to steroids. Majority will completely recover, and minimal change disease is most frequent cause of nephrotic syndrome in children, whereas membranous nephropathy is the most common cause of nephrotic syndrome in adults, is what you need to emphatically remember. Very good to see 25 players actively fighting and 31 players online. Good. Question number 8. Now you are seeing the histopathological appearance of which type of glomerulonephritis, doctor? You are able to see a scar. Can you see the scar? That is an important clue. So, doctor, if you have done these questions wrong, that should inspire you to go back to the Incus app and then do a revision. You know, that is the whole purpose of this daily quiz. Very good. Focal segmental glomerulosclerosis. Typically, it affects the older people. There is a sclerosis of some of the glomeruli. That is the reason it's called focal. And also, only a portion of the glomerulus is affected. And immunoglobulin G and complement C3, both of them are in the sclerotic areas. 4 important causes of the FSGS, don't forget, doctor. HIV, heroin use, sickle cell, obesity is what you need to remember. And there's a very poor response to the corticosteroids. Most of them will progress into chronic renal failure. They're all true. So there is a poor response to the corticosteroids. Very good. Kirtana, Snehil, Akhilesh, Vikram, BPL 25. Oh, BPL is below poverty line or Biplav? Biplav. Very good. And Sankirth is in the 6th position. Question number 9. What is your diagnosis? आपको क्या दिखाई दे रहा है? बोलो अर्जुन. द्रोणाचार्य ने पूछा अर्जुन को सीधा इमेज देख के माइक्रोस्कोप से, बताओ बेटा अर्जुन क्या दिखाई दे रहे हैं? Yes, very easy question. I know most of you will crack this. Great. 6 of you are right. Membranous glomerulonephritis. There's a thickening of the GBM. That is what you are able to see. Good. 27 fighters. Akhilesh is on the top. Oh my God. Yesterday only Akhilesh won 500 rupees prize, topping the quiz. Followed by Kirtana, Vikram, Snehil. Excellent, doctor. Now, question number 10. You are seeing a type of glomerulonephritis What type of glomerulonephritis is this? And what are the causes of this type of glomerulonephritis? Is a very, very, very important question, doctor. Once more, this is also membranous glomerulonephritis, doctor. So don't forget. Penicillamine, captopril, gold, and NSAIDs. They are the cause. Then, whenever membranous glomerulonephritis occurs, there will be massive proteinuria. So, any elderly person presenting with massive proteinuria, you have to be careful to think about membranous glomerulopathy. So, you should always evaluate an underlying malignancy. Commonly lymphoma, even lung cancer, colon cancer, melanoma, SLE, similarly HBV, HCV, syphilis, schistosomiasis, and malaria. You should not forget. And diabetes mellitus also can present with membranous glomerulonephritis is what I want to. Malaria and membranous glomerulonephritis. Absolutely. HIV is associated with FSGS. FSGS. That is what you need to remember. Very good. Vikram is on the top and some सारे दुनिया बेताल खाली विक्रम ने correctly आंसर किया इसको बढ़िया विक्रम question number 11 now you are seeing the immunofluorescence appearance so what is this immunofluorescence appearance signify very classical typically the immunofluorescence appearance. So there is a granular deposition of the IgG and C3. And typically it is once more membranous glomerulonephritis. So it is the most common cause of the glomerulonephritis in adults and diffuse thickening of the glomerular capillary wall and also it can lead to renal vein thrombosis. Please remember. Membranous glomerulonephritis, you should remember two things. One is it leads to nephrotic syndrome. It causes renal vein thrombosis is what you should remember. Vikram, Viplav, Sanket, absolutely rocking. Question number 12. Where do you see this appearance? What are you seeing in that appearance? भैया आपको दिखाई दे रहा है सब एंडोथेलियल इम्यून कॉम्प्लेक्स डिपॉजिट्स और एरोस आपको दिखाई दे रहे हैं सब एंडोथेलियल मेसेंजर इंटरपोजिशन so this is typical of MPGN type 1 absolutely 7 of you are right excellent 28 players have fought this Akhilesh Kirtana Sanket, Faiz, Neeraj. Absolutely answered right. Question number 13. Question number 13. So you should remember, subendothelial deposits बोले तो MPGN type 1. अभी यहाँ क्या दिखाई दे रहे हैं आपको बेटा? Tram track appearance. Where do you see that? Railgadi chick ja rahe na. So where do you see that? Very good. MPGN type 2 is what you need to remember. Very good, doctor. Vikram, Akhilesh, Faiz, Neeraj, and Vipla. Absolutely. Question number 14. Where do you see this histological picture? Please look into, I hope that it's very clear in your smartphone. Very clear in your smartphone. Very good to see 14 online students, even the online students attending on the YouTube. Please don't forget that you can, even if you're a little late also, you can still be able to join the quiz. I want all of you to catch up your smartphones wherever you are sitting. जब तक क्विज का टाइम हो गया, चलो भाई क्विज खेलो, 500 rupees win करो टॉपर बनके, and you become excited to play. That should be the spirit every day. So on the top, I have typed the quiz link. Please use that quiz link and join. And also call our helpline. Be part of our WhatsApp study group, and you will get a notification. We will shoot out about the quiz and the quiz link beforehand to you, and what time we are going to have the quiz. Every day we are going to have a quiz. Every day we are going to give a cash prize to the winner. So, doctor, let's see who are the winners of this. It is Kimmelstein-Wilson's lesions. Kimmelstein-Wilson's lesions of diabetic nephropathy. Akhilesh, Biplav, Sankit, Faiz. Oh, Faiz didn't answer. Lahari correctly answered. Aha answered. Then WHO. Few of you have correctly answered. Very good. Question number 15. Where do you see this appearance? Very classical. Come on, doctor. Where do you see this appearance? Where do you see this appearance? So, doctor, all the explanatory answers for this, each of the quiz question, it will be uploaded into the Incus app. So please don't forget to download the Incus app. 999 rupees में आपको 3 साल का नीट पीजी कोचिंग मिलेगा. दुनिया में कोई भी इतना सस्ते में नहीं देगा. मैंने बोला मुफ्त में दे रहा है. Even 999 is costly, I said. But all our employees said, sir, हम तो जरा चलाना है, सबको तनख्वाह देना है, इसलिए 999 rupees 3 साल के लिए दे दो बोल के बोले. So I said, okay, all right, let's give it, because everyone today 60,000, 70,000, plan A, plan B. What are those crazy prices, man? Are they giving some Mrita Sanjeevani to the students? No, nothing they are giving. Everyone gives the same. Why it should be so costly, right? Whether 100 students buy the coaching subscription on the app, or 1,000 or 10,000 or 1 lakh students, it is the same price. It doesn't cost me anymore. Then why I should make it costly for the students? So all that plan A, plan B, and national authors will come and teach with us. See, ultimately who teaches is not important. How much you learn by yourself, how much you remember yourself. The whole purpose of the coaching is to give you some company every day, so that चाय पे चर्चा में सब लोग इकट्ठा होके जरा पढ़ाई करें तो सीट मिल जाएगा, right? So no need of wasting tons of money. And tomorrow when you become medical consultants, remember, wherever option is there, you should be able to make the price of treating the people come down to the ground level, so that even every man's right is to be healthy, to be treated. That's what they all have taken on the Hippocratic oath. So Dr. Akhilesh is on the top, followed by Vikram, Viplav, Sankit, Lahari and Kirtana. Question number 16. What is wrong about this condition? Wrong about this condition. Yes, doctor. What is wrong about this condition? Yes. So, very good. That is right. So what you have seen over there is post-streptococcal glomerulonephritis, PSGN. It led to nephritic picture, not nephrotic. 95% completely recovered. Subepithelial humps, decreased serum C3. These are all the true statements. Now, Dr. Akhilesh, Viplav, Sanket, Kirtana, Neeraj. Question number 17. There is a gross hematuria within 48 hours after upper respiratory infection, and the histology has been presented to you. So what you are seeing here, classical feature. This is a classical example of, come on, IgA deposition, IgA nephropathy. The most common type of glomerulonephritis, pura dunya mein worldwide, most common type of glomerulonephritis, IgA nephropathy. Celiac disease, it is seen. It's called synpharyngitic hematuria. Bhaiya, pharyngitis aayega, within 48 hours mein red colored urine produce karega bachcha. So synpharyngitis, unlike post-acute glomerulonephritis, where it takes around 3 to 4 weeks of time between pharyngitis and glomerulonephritis. Yaha only 48 hours. That's the reason it is called synpharyngitic hematuria. And what type of hematuria is the Burgess disease? Benign recurrent hematuria. Benign. Why benign? Because people don't progress into renal failure. It is benign. Benign, recurrent. Every time they get the pharyngitis, they keep getting the hematuria. Benign, recurrent hematuria. Most common causes IgA nephropathy is what you need to remember. Very good. 31 players have fought this question. Vikram, Viplav, Neeraj. Now, Doctor, question number 18. Now you are seeing a laminated GBM, abnormally split GBM. ऐसा GBM कहाँ दिखाएगा आपको? What is your diagnosis? Punch your answer, doctor. So what is your diagnosis? Whoa, that's great. That's great. Most of the cases are X-linked. It is Alport syndrome. X-linked. CON4AS mutation. Defective GBM synthesis. There is a lamination of the lamina densa. And also, that is the most important feature. Very good. Akhilesh, Vikram, Viplav, Neeraj, Sanket, they are closely fighting. Very good. Snehil, Aha, Dr. Medicine, Anil, Sauman Mondal, and Asha Kumari, Ashwati, RBS. Everyone answered this correctly. Wonderful, doctor. Question number 19. Question number 19. Now, HRCT is showing the presence of hemorrhage. And you are finding ribbon-like feature on immunofluorescence. And crescentic glomerulonephritis. What is crescent? Parietal epithelium of the glomerulus proliferates. That forms the crescent. So, it is classical of anti-GBM disease. Good posture which presents with rapidly progressive glomerulonephritis is what you need to basically remember. That's good. So, Akhilesh is clean bowled. Viplav, Vikram, Neeraj, Sanket. Kirtana. Let's see. Question number 20. What is the type of lupus nephritis you are seeing, Doctoro Italia? Lupus is divided into class 1, class 2, class 3, class 4, class 5. So what is the difference? No renal involvement, type 1. Mesangial form, type 2. Focal proliferative form, type 3. Diffuse proliferative form, type 4, and membranous form is type 5. Diffuse proliferative form has been shown to you. 11 of you are rocking, absolutely right. Good to see 32 fighters. Viplav on the top, Vikram follows. And Kirtana correctly answered type 4. Snehil, Lahari, Denny, WHO, Dr. KP, Dr. Medicine, Sana, absolutely right. Very good, doctor. Always Spardaya, Vardhathey, Vidya. Fight every day. The whole purpose of Dr. Murali Bharadwaz is to become that Dronacharya, to bring that competition, Spardaya, Vardhathey, Vidya between you guys, and inspire you to go back to the Incus app and prepare for the NEET PG. Happily, you should enjoy every minute of the NEET PG preparation. Polyarthritis nodosa. So basically, doctor, you have type 1 to type 3 RPGM. Type 1 होता है anti-GBM disease. Linear deposits of IgG and C3 on GBM. Good pasture is example. Idiopathic is most common type. Then type 2 होता है immune complex mediated RPGM. So PSGM, SLE, and phenolphthalein sperpira. Then comes quasi-immune ANCA positive type of RPGM. उसमें होता है vaginous, which is Cianca, polyarthritis nodosa, which is Pianca. So that belongs to type 3 RPGM is what you need to remember. Very good. Viplav is not going to let Akhilesh take the 500 toppers prize. Viplav, Vikram are trying to hold a dominating position. Let us see. 2 to 3 more wrongs by Akhilesh will make Viplav and Vikram to move far ahead. Still, there are 30 questions left over. कुछ भी हो सकता. So, what supports the diagnosis of Burkitt's lymphoma? यहां से बहुत फास्ट चलता है डॉक्टर. क्वेश्चंस का आंसर्स फटाफट आंसर करना पड़ेगा. इट्स अ रैपिड राउंड फ्रॉम हियर. यस, T814 karyotypic analysis. Very good. Viplav on the top. Now, question number 23. A renal biopsy on light microscopy revealed large hypercellular glomeruli with mesangial proliferation and splitting of the basement membrane. What is your diagnosis? Splitting of the basement membrane. अभी हमने डिस्कस किया. Whoa, that is membranoproliferative glomerulonephritis. Still, Viplav is maintaining that domination. Question number 24. A 56-year-old woman presents with 4-month history of recurrent non-bloody diarrhea and whistling sounds while breathing. She has no history of any GID problems or asthma, and multiple small lesions are there. So that is classical of carcinoid syndrome. Absolutely. That keeps Viplav, Vikram, Akhilesh, Kirtana. Question number 25. A 40-year-old man who is not a known case of epilepsy presents with tonic-clonic seizures, intermittent bloody stools, multiple polypoid lesions in sigmoid colon. What is the most likely diagnosis? Punch your answer, doctor. Yep. Oh. Charcot syndrome. Absolutely. That keeps Viplav on the top. The auscultatory finding of the systolic murmur of MVP What is the maneuver that will decrease the size of the ventricle and increase the murmur sound? Actually, option B and C were correctly, same options came up. Okay. Now, question number 27. What is the first sign of hypovolemic shock? Hypovolemic shock, first sign. Sign, not a symptom. Yes. Good. Tachycardia is the first sign. Easy question. Good. That keeps Viplav on the top. 28. What is the most common cause of death in acute myocardial infarction? Most common cause of death. I think most of you will correctly answer this question. Yes. Punch. Right. Ventricular arrhythmia. Ventricular fibrillation is mainly responsible. So the whole idea, doctor, examination के stress में, examination hall में, that stressful situation also, you should quickly take a decision reflexly and answer. So what is the problem in osteogenesis imperfecta? Fat answer karo, doctor. Come on. That's good. A defect in type 1 collagen is what you need to remember. Viplav and Akhilesh are closely fighting. Whoever answers first will go on to the top. Initial immune response against gonococci. What is the cell type that mounts that initial response? What is that cell? So different types of cells you should be able to recognize. Very good. It has a multi-lobular nuclei. So you must know how to recognize a neutrophil, eosinophil, etc. Oh, most of you are clean born. Question number 31. A 32-year-old adenocarcinoma of the lung develops ptosis and hydrosis and ophthalmos. What is the cause for it? Easy question, huh? Oh, most of you will correctly answer. Great. That is the Horner syndrome because of the compression of the cervical plexus. Absolutely. But Akhilesh is punching very fast. That is how Viplav, though he is right, he got only 68 points. Yes. Question number 32. Most likely non-ocular tumor that happens in a retinoblastoma is a second tumor. Easy question. I know most of you will correctly answer. Pum, punch. Yay! It is osteogenic sarcoma. Absolutely. Viplav, Vikram, Kirtana, Sankit. 33. 59-year-old man, intermittent attacks of diarrhea, intermittent episodes of wheezing, facial flushing. What is your diagnosis? Easy question. I know all of you will correctly answer this. Absolutely. It's a case of carcinoid. That's the reason hydroxyindole acetic acid will be typically elevated. Whoa. Oh, Viplav is clean bone. Vikram, Kirtana, Sankit. Question number 34. Which HLA subtype is associated with rheumatoid arthritis? The rheumatoid arthritis. Yes, all these HLA subtypes, you have to be 100% sure, doctor. Hey, that is HLA DR4. Good. Most of you correctly will, obviously you will correctly answer. 35. What happens in acute hepatitis C virus infection? What will it lead to? Will the virus clear? Will it lead to cirrhosis? Will it lead to fulminant hepatic failure or chronic hepatitis C? Beautiful question. Chronic hepatitis, chronicity is very high with hepatitis C is what you need to remember. Very good. Now, doctor, question number 36. 58-year-old, history of heavy smoking, increasing shortness of breath over the past few months, and there is a barrel-chested dyspneic. So all these are in barrel chest is a very important clue. A, that is centri acinar emphysema. So you must know each type of emphysemas, what are the underlying causes. Good. Question number 37. Compared to normal lung tissue, what cells are prominent in the patients who have decompensated heart failure? Decompensated heart failure. Whoa! They are called the heart failure cells, which are the hemosiderin-laden macrophages, is what you need to remember. And also, doctor, all this quiz, the associated PowerPoint is uploaded into the Incus app. So that is the reason, don't forget to download the Incus app. Tell your friends also to download the Incus app. East or West, who is the best? Incus is the best. You get 800 hours of video of 2000 HD videos from 953 topics. You also get 60 full-scale grant tests and discussions on every Sunday. Full-scale grant test and discussion. Then you also have everyday evening live online interactive classes with NEET PG toppers and national faculty. 35,000 PowerPoint slides of notes and 60,000 MCQ question bank for NEET PG played in the format of a quiz. What else do you need? Everything for just 999 rupees for 3 years activation. Only 1 rupee per day is the price. Cheaper than going to a movie with one girlfriend, right? So, but that is going to help you. And there is no need of wasting money on 60,000, 50,000, 30,000 discount plan, plan A, plan B. There are no so many plans in Incus app. You have only one plan, 999 plan. So please tell all your friends. Today only hundreds of students are every day joining. So I am saying that this is not a one-day offer, last day offer. Dr. Murali is available for 1 rupee every day for you until Dr. Murali is alive. Still the students say, we love to join. And they bring tens of their friends also in joining. So that is the reason, doctor, I am telling you, read every day. The role of a teacher is not to teach you. The role of a teacher is to become your classmate, sit along with you, and study along with you. That is what you need to remember. And Dr. Murali Bharadwaz will do that every day, religiously, until you get a seat. So, doctor, continuing our journey. So, please call our helpline to be part of our WhatsApp group also, so that इवनिंग कितने बजे को एक क्विज शुरू होगा हम पहले ही बताएंगे. Question number 38, last 12 questions. Subdural hemorrhage में what is injured? Is it an artery? Is it a vein? Is it a berry aneurysm? Easy question. All of you should answer this correctly. Great. It is the bridging veins which become damaged and lead to a venous bleed. Commonly it presents with something like a dementia. Is a presenting feature of subdural hemorrhage. No history of trauma. Whereas extradural is arterial bleed from the middle meningeal artery and typically is lucid interval. It's seen in the extradural bleed of in the extradural hemorrhage. Diabetes, osteoporosis, hypertension, recent weight gain, abdominal striae. So, what is the most likely explanation? Very good. It's a case of adrenal adenoma leading to hypercortisolism. Question number 40. 58-year-old man with 7-month history of fatigue, history of pernicious anemia. What will be the findings that you will see in him? Yes. 58-year-old. Absolutely. Low levels of urinary vitamin B12 without administration of intrinsic factor. So pernicious anemia is an autoimmune destruction, is what you need to remember. Come on, doctor, we are reaching the end of the game. Who is going to win 500 rupees cash prize? Carter-Jenner syndrome. Oh, come on, very easy question. Biscuit question. All of you will answer this correctly. Yes, Dr. Dineen. Absolutely. Still there are few people who are answering this wrong. मैं आपको फ्री में वो 999 का भी जरूरत नहीं है, फ्री में कोचिंग दे देता हूं अगर इतना सिंपल क्वेश्चन को रॉन्ग करे तो. So Dr. Viplav is on the top. Vikram, Akhilesh, Sankeet, Kirtana, Snehil, Lahari, Dr. Medicine, Aha. Wow. भैया last 10 questions, कुछ भी होगा, कुछ भी हो सकता. Who is going to take that 500 rupees cash prize for today's pathology contest? Good posture. What pulmonary condition would present with similar respiratory function? Oh. So पहला good posture में क्या होता है मालूम होना है. That's right. Even sarcoidosis also can present similarly. Right. So basically there are two types, obstructive, restrictive lung disease. So once alveolar hemorrhage occurs, what does it lead to? It's more likely to lead to a restrictive defect. So that is the basis of that question. Question number 43. A 70-year-old man, 35 packing, smoking history, hypertension presents with left shoulder pain, physical examination, drooping of eyelid, constricted pupil. What is your diagnosis? Easy question, right? Pan-closed children. Absolutely. Great. Viplav, Vikram, Akhilesh, Sankeet, Kirtana. Closely fighting with one another. Last 6 questions to decide. 52-year-old, scleroderma, 5 years, increasing difficulty swallowing. So what is the abnormality in the esophageal muscle function? So basically, esophagus has both a smooth muscle and also skeletal muscle. Great. In the lower 2/3 of the esophagus, there is an atrophy of the smooth muscle is the abnormality you will see. Oh, Vikram, last this question. Viplav is on the top. Akhilesh, Sankeet. Question number 45. Question number 45. What are the procoagulant factors produced by the endothelial cells? Come on, doctor. Endothelial cells. Endothelial cells. Come on, that's a clue. Great. Von Willebrand factor is what you need to remember. Viplav Vikram Akhilesh, still fighting. And Ankit Kumar, Asha Kumari, Asma, Vasu, also correctly answered. Good. Last four questions. Hyperparathyroidism, all the following lesions can produce, except. Oh, easy question. Very easy question. Not at all difficult. Yes, digorgime parathyroid aplasia will be there. Hypocalcemia will be there. Very easy question. Viplav Vikram Akhilesh. Dekhenge, who is going to hit the jackpot? Mononuclear portal inflammatory infiltrate that disrupts the living plate. It's called piecemeal necrosis. Kahan hota hai? Easy question. Come on. Once more, Incus app में pathology का गर्मा-गर्म discussion हुआ doctor. Chronic active hepatitis. Oh, only 4 of you correctly answered. Viplav rocks as usual and moved quite forward. I think विक्रम अखिलेश को बहुत रन रेट का जरूरत पड़ेगा विक्रम को अगर विप्लव को क्रॉस करना है तो. क्वेश्चन नंबर 48. गुड पास्चर्स डिजीज में ग्लोमेरुलर डैमेज को हाउ विल यू डिस्क्राइब इज द क्वेश्चन. Easy question. Right. There are autoantibodies against the glomerular basement membrane. Absolutely right. Very good. Both Vikram and Viplav are right, but Viplav is astonishing speed में answer कर रहे. The most common primary site of origin of Paget's disease of the nipple. And easy question, very easy question. Short textbook of gynecology में भी आपको मिलेगा Paget's disease. Oh, doctor. Good. Last question, which is going to decide who is the 500 rupees winner of today evening. Pseudo-palisading necrosis, endoneural proliferation, hypercellularity, atypical nuclei. ये सबको सुने तो किसका नाम याद आएगा? Come on, doctor. A glioblastoma multiforme is what you need to remember. Oh, Viplav lost this. Oh my God. BPL 25. Jindabad, Jindabad, Jindabad. Very good. 500 rupees cash prize. Viplav is, please take a screenshot. Please send it to our helpline number 900868 And also, please give a small video how you enjoyed the today's quiz, how you became topper. Also, please go to the Google Play Store and write a good review. Give a 5-star rating. That will help us to reach a higher level on the Google Play Store rating. And students are our highest priority. Viplav, Vikram, Akhilesh, Sankeet, Kirtana, Snehil are our toppers, and thank you very much for everybody else who also participated, and we all enjoyed a great evening. So a lot of times students say, मुझे anxiety आ रहा है, tension आ रहा है, एग्जाम पोस्टपोन हो गया, ये हो गया, डिप्रेशन हो रहा है, और वो सब कुछ छोड़ दो. The most enjoyable period of the life today, preparation for NEET PG Doctor. कंसल्टेंट बनने के बाद क्या मजा है, पीजी बनने के बाद क्या मजा है. पीजी बनने के बाद कुछ भी नहीं है, गधे के जैसे इधर उधर दौड़ना पड़ेगा. एचओडी को भी नाराज होता, गर्लफ्रेंड भी नाराज रहता, पेशेंट्स आर आल्सो एंग्री ऑन यू. Life is boring. What is most interesting part? While you are preparing for NEET PG. So enjoy everyday preparation, everyday evening, win 500 rupees cash prize, and also get excited. Go back to the Incus app, pick up those topics where you are really doing bad in this quiz. Daily, thoda, few steps, let us improve. And one day you become topper. Kabhi alvida na kehna. You send me a laddu on the WhatsApp. Good luck. Thank you.